Live from Atlanta, Georgia, it's the Zach Ballinger Show, where we help you find your direction through passion and purpose. I am Zach Ballinger, your host. Excited to be here again. Really excited to have Dr. Jonathan Laymance with us today. Dr. Laymance, thank you so much for joining us.
Thanks for having me. Honored to be your first guest.
Yeah, so, though, how this is going to work, just for my audience sake, we're going to do a lightning round where we ask you about 9 quick questions where we want to learn a little bit more about your background. We'll get into a little bit more of in-depth questions, and then Dr. Laymance has an exciting announcement at the end, and we'll actually take some of your questions off the Facebook stream. So if you've got any questions out there that you'd like to ask Dr. Jonathan Laymance, feel free to. So we'll ask you, Dr. Laymance, so what is your exact title?
I am a family physician.
And how many years have you been a family physician?
I've been in practice 7 years after completing 3 years of residency, so a total of 10 years.
And that's one of the questions I was going to ask you. So let's say somebody wanted to be a family medicine doctor. What kind of training, education, certifications do they need to go through?
Sure, it's a long road. So you complete your undergraduate training, which is 4 years, and then you apply to medical school, which is an additional 4 years. And then at that point, you apply for residency, and the shortest residency program is 3 years. So at minimum, you have 11 years after high school.
Gotcha. And so what is the most favorite thing you like about your job, being a family medicine doctor?
Sure. So family medicine is great because I never know what's going to walk through the door on any given day. I never have 2 days that are the same. So you just have such a variety of patients. And, the reason I went into medicine was to be able to help people through small problems and big problems. And so just being able to do that on a daily basis is really rewarding.
What did you want to be when you grew up? We all had kind of a dream career that we've always wanted to do. What was yours?
I always thought I'd be a doctor. So, I was born a couple months early and spent some time in the NICU and just kind of had some asthma and other medical issues growing up. And so I was always in and out of doctors' offices. And so just intrigued by medicine. And it's really something that I've just always thought that I wanted to do.
So you kind of said it in the beginning, but if you had to pin it down, you said, you never know what a day looks like, but could you walk us through maybe a typical day?
Sure. So typically arriving at the office about 7 o'clock. First patients are usually there at 8. So doing a lot of paperwork, medication refills, that type of thing in the morning before we get started. And then usually some routine follow-up visits and physicals for the first couple hours of the day. Seeing our diabetic patients with chronic medical problems. And then you get into your sick visits, walk-in, call-in visits that you'll see kind of late in the morning. And then take a short lunch break if you're lucky. And then you'll do it all again from about 1 to 5. And then you're on call after the doors close at 5 o'clock.
So last question in the lightning round, what do you like least about your job?
That's a toughie. Let's go with government bureaucracy. So just all the red tape, dealing with insurances and just trying to work with insurance companies and get through prior authorizations and certain things so that the treatment plan that you would like to put in place, that you can help get rid of all those barriers and truly take care of the patient like you'd like to do.
Makes sense. So you did good. You survived the lightning round.
Not sweating yet. So that's
So more of an in-depth question for you, full disclosure out in the audience, Dr. Laymance and I actually have went to elementary school, middle school, high school. We went to different colleges, but we always stayed in touch. And, Dr. Laymance, what's so cool about this is I actually knew you growing up. And I remember being jealous of you because I think a lot of us, me included, and the people I talk to don't really know what they want to do when they're in high school or college. Even in college, I still didn't really know what I wanted to do or what my calling was in life. How did you know, at just such a young age, what your passion was?
I think that you use the word that I would choose, and that is a calling. I think that if you go into medicine there's plenty of careers out there, but I think if you want to deal with working in the medical field, that it truly is a calling. And you just really have to have a desire to help people, because there's plenty of things that you can do in life, but just to do this day in and day out and try to not get burnt out, I think that you truly have to be called to the career.
Another question for you, the training is so long, and, I think doctors deserve to make a good living because they've deferred so much in education, and they put off going into the marketplace where, I went into the marketplace at a pretty young age at 22. And so, for you, what kind of obstacles, I mean, behind every success, I feel like when I talk to successful people, there's always an obstacle in your way. Is there a time you look back through your career or your life or your education where you were like, wow, I was able to overcome that? Any particular moment you can think of?
Sure. I would say, getting into medical school in general is a competitive process. And so, a lot of times some people will apply for 3 years before they actually get into school. And so that just furthers the gap, and you're relying on your undergraduate career and trying to find a job during that time gap. And so I didn't get in the first year after undergrad. And so I actually did have a single gap year. And so you just really begin to question things when all the dominoes don't fall perfectly into place. Is this truly what I'm supposed to be doing? But perseverance, persistence, studying and retaking that test that you didn't do so well on the first time, and just overcoming that obstacle so that you can follow your dreams.
I look back at your story. I remember that so vividly. And, a lot of students will ask me, well, does it, matter where I go to school? So I just want to ask you, how many of your patients come into you and ask you what your GPA was?
Not one. And I had a really good one too. So it's kind of disappointing, but but none. They don't ask you where you went to school. They don't ask you what your grades were like. They care that you have the degree, that you had the additional training, and that you're just a trustworthy person that they can put their trust in of their medical care to.
Yeah, I think that's so cool too, because I talked to a lot of people, and they've come from small community colleges, or they've come from private institutions or big state universities, and in all walks of life, people have been successful going to school at different places. And when I hire a lawyer or CPA or go to a doctor, I don't think I've ever asked them, oh, where did you go to school, or what was your GPA, or what did you make on your LSAT test? It's, hey, do you have the experience, or can you treat my illness? And so I'm sure, right. And for those that don't know you, you actually have an outstanding reputation in the community and providing healthcare. What is your kind of philosophy on patient care? Do you have one as far as your own kind of look on things when you treat a patient? What does that look like for you?
Sure. I like to treat patients the way that I would like to be treated, or that I would want my family members to be treated. And I think when you do that, patients just really, you develop a good rapport with them from the onset. They can tell that you genuinely care about them, and you genuinely want them to be a better, healthier them. And so I think that's kind of probably my philosophy.
That's awesome. And, when you think about your career pathway, where do you, when I talk to doctors, I never think that they do much career development because, hey, you went to school, you become a doctor, you want to see patients, but do you have long-term goals, like a 5-year or anything like that, where you want to take your career maybe a different direction, or even have some goals as, hey, I want to treat these many patients? I think there's always some type of goals we all have to achieve.
Right. So I'm kind of in a transition period myself, so don't want to spoil the big announcement, but I've worked about 30 minutes from my hometown for the past 7 years, and so I'm making a transition right now as we speak to working in my hometown. And so, just getting that clinic up and running, and, just adding more patients from my hometown that I can help care for. I plan on being here for a very long time. So, instead of a 5 or 10 year outlook, I'm hoping this is about a 30-year outlook.
Well, let's just go ahead and give away the announcement. So
Sure.
tell us about your big announcement, and tell us where you plan on practicing.
Sure. So I am opening a medical clinic here in Wartburg. It's called Summit Medical Group at Wartburg, family medicine and urgent care. And so I'll be a single provider, family physician, providing hometown health care for people of all ages. So from newborns, pediatrics, all the way to our geriatrics. And ultimate plans are to open half of the office as an urgent care center, staffed with some nurse practitioners. That way we can take care of the walk-in clinic and urgent care needs of the community. So right now, people have to drive about 30 minutes to go to surrounding cities, Oak Ridge, Harriman, Crossville, just for minor things, cut their finger and needed some stitches. They've got a runny nose or a sore throat. And so they're just having to travel out of the county for that quick medical care. So just hoping to provide greater access for our hometown and for Morgan County.
That's great. And for those of you who are listening, and that's Wartburg, Tennessee. And so we've got listeners from all around the United States, but this is one for the Tennessee area. Wartburg, Tennessee. Jonathan's going to be opening his practice to new patients here. I think you said September 1st, September 1st. So congratulations, Dr. Laymance, for coming to town. So that brings me to the next question is, I think one of your careers actually, because you talk to different doctors and they have a passion for rural medicine or rural healthcare. What does that mean? And what are the, what does a provider face differently in a rural healthcare setting than they would like in a big city?
Sure. So, when you're in a rural area, you have limited resources. You don't have medical specialties usually within your town. Now, thankfully, we're not so remote that people have to drive a couple hours to get to a specialist. But a lot of specialists, you'll have to drive 30 minutes, 45 minutes, an hour just to get to a specialist's office. And when you're in a rural area, there's sometimes some increased poverty. And with that, it makes it more difficult for people to travel those distances to see specialists. So instead of relying on specialists as much, you try to increase your own skill set and be able to just kind of take care of some additional medical problems that sometimes you might have punted to a specialist if you lived in downtown Atlanta.
Makes sense. And so kind of going back, I've talked to some college students that, they're in their freshman, sophomore, junior year. They're playing around with a pre-med thing. They think that's a route they want to go. What advice would you give them if they're on the fence and they're like, Zach, I'm not really sure. I want to be a doctor. I kind of do and I kind of don't. What would you recommend them to do to find out more?
Sure. So, I would say that you really need to be sure that that's something that you want to do before you invest the time and the finances that it takes to go to medical school. It's a really good idea, even in high school. If you've waited till college to do it, that's fine as well. But just to shadow some physicians, there's a lot of fields in medicine. And so just shadowing a doctor in whatever field that you're interested in, spending a few days with them, seeing their day-to-day life, seeing what they do on a daily basis, and make sure that's truly something that interests you and that you feel like you're doing it for the right reasons.
Yeah, thanks for reinforcing that, because I that's what I say on college campuses all the time. People want to do a certain career, but they've never really followed around anybody doing it. And that's kind of what you mean by a preceptorship is let's spend some time with people in those careers. So let's say you wanted to be a veterinarian. Wouldn't it be a good idea to network with somebody in that particular field before you decide, hey, I'm going to go into school. Oh, wait, I don't like blood and guts.
Absolutely.
So it might be a good idea, like you said, through preceptorship. Any courses that you recommend for somebody that's entering from the high school level? Let's say you're in high school now, your dream is to be a doctor. Any major they should pick or specific courses you would recommend to them?
Sure. So used to, it seemed a little bit more simple. Everyone would do kind of a pre-med track where you're taking some core science courses, and there are certain classes that are required. So you want to go ahead and get plugged in with a guidance counselor that can kind of talk you through, well, what classes are required to get into medical school? You got to take your biologies, chemistries, physics, organic chemistries, and you have to take those classes. But I would also advise that you choose a major that interests you and not just pick something that sounds good in hopes that you think that the admissions panel is going to look highly and favorable on. I've had a lot of admissions folks will say, they want you to be a well-rounded individual. So you can major in English and still get into medical school. You just have to take your prerequisite courses. And something may happen and you may not get into medical school. And if you have this degree in pre-medicine, what does that even mean? Major in biology or chemistry or something along those lines. And sure, you can fall back on that, doing education and other things. But I think that just picking something that really interests you and making sure that you also get those core classes in.
Great point, because, first of all, not everybody gets into medical school. And second of all, sometimes you change your mind. So let's say, you're going through this MCAT process and you're like, look, this isn't for me, or I've taken sciences and it's not something I like. Why not have a fallback major where you can get a job into the marketplace? Like you said, if your backup plan is to be a nurse or a nurse practitioner, you could easily get your bachelor's degree in nursing or something like that, where you can be a well-rounded individual, just like you said. I think that's very important. Or, I've seen medical, I've talked to a lot of doctors and they have different degrees that you'd be surprised about that they actually had. I think I talked to one the other day that had a sports management degree.
Yeah.
And so, but their fallback plan was to be a sports agent, believe it or not. So that's really good advice. And so thank you for sharing that. And then, there's so many physicians. When you talk about healthcare and doctors, there's so many different types of doctors. How did you know? Because me and you even talked about this in college and in high school, that you always wanted to come back to your hometown to practice medicine. How did you know that 20 years ago?
Right. I think that it was just a dream and a calling that I felt that I had. And just to know that that's what I wanted to do. And that's what made me choose family medicine. I enjoyed, throughout medical school, you go through and you spend a couple months in surgery and, OBGYN and different specialties. You're exposed to it all, but you ultimately have to decide and narrow down a field before you apply for residency. And I knew that I wanted to come home to a small rural area. And I just felt that family medicine would be the best fit for this area, being able to care for all ages. I have training in delivering babies. Don't want to do that anymore. I have training in it. And then seeing newborns, pediatrics, and all ages. So I almost became a pediatrician because I really enjoy kids. And that's kind of a passion that I have. But I knew that I would be better served in this area by doing family medicine and being able to care for all ages.
I think it's so awesome, because I think Wartburg, Tennessee lacks that right now, is where, they could take a kid or, someone in the pediatric population to treat. And so you're filling a need in the community. And it's amazing, 20 years ago, you had this vision of what you're doing right now. I mean, we're now the old people, now, which is weirdly weird and hard to say. But 20 years ago, it's amazing you had this vision over your career, and you're just doing something that you really love and enjoy. And when I talk to people, I always say there's days that you're not going to like in your job.
Mhm.
That doesn't mean you don't like your job. Every day is not going to be roses and sunshine. And you're obviously passionate about your job, but you would agree with that, right? Not every day is a good day. I mean, you're going to have some really tough days, right? As far as even being a physician, I bet you make some very challenging and tough decisions, or you see some tough stuff.
Absolutely. I mean, you have bad days no matter what you're doing. Um, you know, there are days that you have to inform someone that they have terminal cancer.
Yeah.
And, that makes for a very tough day, but you just have to do it with a compassionate and empathetic approach. And, there's always tomorrow. So you always hope that tomorrow is a better day when you have that bad day.
Yeah. No, that's a great saying. And so I'm going to wrap it up here with some questions. Let's do it non-work related. So what's some of your hobbies? What do you do outside of being a doctor that you enjoy?
Yeah. So big Tennessee Volunteers fan. So
I'm sorry.
I am too for the past decade. So enjoy going to football games and basketball games. So obviously that's changed this season, but just enjoy that. Going for hikes, enjoy some, we've got a lot of hiking trails here locally. You got the Smoky Mountains nearby. So just spending time outdoors and spending time with family.
Gotcha. And so I'm going to end it with some questions, but I did have one question that came through from a student of mine, and they asked, how do you know if you want to specialize? So let's say, you're down that residency route. It looks like this particular student that they're asking the question, they're like, should I go on to get a fellowship? I mean, I'm pretty sure you can't. So, I mean, there's a lot of stuff to know there, but it's just basically, how do you know if you have the call on to go on to be specialized?
Sure. So again, that comes back to medical school and kind of doing rotations and figuring out what you like. If you wanted to be a cardiologist or a GI doctor or a neurologist, you're typically doing a residency in internal medicine. And so that is a 3-year residency program where you take care of patients 18 and up, chronic medical problems and things of that sort. And then at the end of your residency, you can make the decision to do a fellowship in cardiology. I believe that one's 3 years in addition to that. So just researching, how many more years am I going to have to go? How many more years of delayed income am I going to have in order to reach that end goal that you want?
Here's a good question that's come in. What was one of the hardest classes you took in college?
I would say that probably organic chemistry. It's typically a good weed out course that med schools use because they want to see if you're going to tough it out and stick it out. And that's just a tough class.
Gotcha. We'll take a couple more. Another one says, can I go to a 2-year community college first before going to a 4-year school?
Absolutely. I did. I started out at New State Community College, did 2 years there before going on to Tennessee Tech and getting my bachelor's degree there. So, you certainly can do that. And, a lot of states nowadays offer free tuition for the first couple of years if you do a state community college. So the less debt that you're in, the better, because medical school is expensive and it's a long road before you get on the track of being able to pay that back. So you want to look at your financial outlook on the long term as well.
That's the next question that's on here is, how do I get to go to a medical school on a budget?
Yeah, so you need to live like a medical student, borrow as little as needed to get by. You don't want to be borrowing a lot of money for extravagant things, housing, food, clothing, but you don't need to be buying name brand things when you're in college. You need to be living on a budget so that you can incur less debt along the way. And then, you'll hear all along, even when you get done with residency, if you'll live like a resident, that limited income for just a few more years after you get out of residency, then that'll help you on your road to paying back off your debt.
That makes complete sense. And so, and you can still see me, right? I don't know what happened. Well, thank you so much for taking the time to join us. We appreciate it. We've learned a lot. So if you're in town, go support Dr. Jonathan Laymance. Thank you for being a part of the show.
Thank you for having me. Good luck.
Right. Take care, guys.
Take care. It still says live. Have you stopped it?
I am now.
Okay.